Good afternoon. Thank you all for joining us today on our weekly COVID-19 briefing. Today, I'm joined, as we usually are, with our Monroe County Public Health Commissioner, Dr. Michael Mendoza. And then today we're also joined by Jamie Saunders, the President and CEO of the United Way, Greater Rochester. Just yesterday, we preached patience to the community and asked everyone to please remain patient as the eligibility and availability of the vaccine continues to grow and change in our community. And I want to reiterate a point I made yesterday, which is the difference between eligibility to receive the vaccine and the actual supply and availability of the vaccine in our community. We do not control the supply or the availability. That is managed by the federal government and the manufacturers of the vaccine. But what we can control here locally is our efforts to make sure that our ability to distribute the vaccine in the days, weeks, and months ahead keeps pace with whatever that availability of vaccine is. And that has been our goal and what our team's been working around the clock on for the last several weeks. We don't know week to week what the vaccine availability will be here. We know who's eligible, but we don't always know what the supply will be. That is a week-to-week decision that, again, is driven through the federal government. But in our efforts, and I want to thank our team for working so hard on this, we have been working to make sure that we can grow our capacity. And so today we're announcing that Monroe County will be standing up an additional public point of distribution facility. We'll be setting up another pod site at the Rochester Riverside Convention Center. The convention center, I think, is an ideal location for our additional county-run pod site. This is on top of the Fleet Center in Westfall Road. Has an abundant amount of space. It is a central location. It's walking distance from the RTS Public Transit Center, and it is part of the county's pod distribution system and strategy that's been in place for years. Effort that has taken around-the-clock work on behalf of all of our teams across every county department. And I want to thank our teams for working on this and setting this up so fast. This pod site at the Convention Center will just initially be able to help us to increase our capacity to vaccines by 700 vaccinations per day to start. And that's just on one shift, and then can be expanded from there. The convention center will be available no later than Monday of next week and will be operational. So we'll be using the same system we've been using to help those who are eligible in 1A and 1B to be able to make appointments. It's an appointment-only system, so we're asking people not to just show up because we can't give you the vaccine unless you have an appointment. But it does help us to be able to increase that capacity, so if and when additional vaccine arrives, we're ready to get it in people's arms as quickly as possible. Related to that, we are still looking for additional registered nurse and COVID clerk positions here in the county. We have some vacancies still. We have not just some, we have a critical need really for nurses to be able to help us administer those vaccines. We have put the qualifications and a link to the application on the county's website. But again, we're looking for nurses who we can bring on to help us with the vaccination effort at any of our 3 pods that'll be operational next week. And so we're asking, in a big call out to the community, we're also hiring additional COVID clerks to help with the vaccine distribution. The positions can help provide clerical support and to the vaccinators on site, data entry, and assisting the site coordinators as needed. Again, that application is available on our website and along with all the qualifications and things of that nature. So we're looking for as many people as we can get as we continue to build out our capacity here. In addition to hiring staff, we have a great partnership, and we've had from the beginning, with United Way of Greater Rochester. And this really goes back to the whole beginning of the pandemic in our community, and the pulling together of people from every sector across Monroe County and really across the region this partnership with United Way to make sure that volunteers have a place to go, a portal to go, and make sure that it's all coordinated and put together in a way that gives us the biggest bang for our buck, if you will, to make a difference in the pandemic. And so today we're really excited to announce a volunteer portal in conjunction with the United Way of Greater Rochester to help all these people in our community. We are surrounded by the best people that you could think of that really just want to help. Our phone rings off the hook. We have tons of emails from people saying, how can I help? How can I help get us through this pandemic? And the United Way stepped up and decided and offered to help be able to take those folks, bring them into a single spot and get them to where we need them, whether that's through the rapid testing site locations, and now as we start to stand up additional public-facing pod sites to distribute this vaccine. And I'm just so happy that the United Way of Greater Rochester stepped up and partnered with us once again to make this happen. Getting through this pandemic is going to take an incredible partnership across this community. We've been doing this now since last March, and we see where this can go. We see where this is going to end. The vaccine is here. We know what works. We know what we can do to keep our numbers down. And by working together, we will make that happen. So I want to thank the United Way for doing that, and I'm going to turn it over to our partner here who's helping to lead the way in this community effort is Jamie Saunders. She's the president and CEO of the United Way of Greater Rochester, and she could talk a little bit more about this initiative and how we're collaborating to bring as many people as possible to bear in this effort.
Thank you so much. You can hear me okay? We're good? Great. Wonderful. Thank you so much, County Executive Bello, and always so great to see Dr. Mendoza and the Herculean effort done by our county and our partners in government. Just thank you. I am so honored to join you today and truly to take this opportunity to say to our broader community, thank you. What we have done together over the last year has been incredibly inspiring. When COVID hit our community in March, thousands of community members rallied in innumerable ways. More than 5,000 of you signed up right away to volunteer, doing everything from boxing and distributing emergency food, to sewing masks for frontline workers, to checking in with older adults, to supporting kids in their distance learning, and more. You stepped up and contributed nearly $7 million to the Community Crisis Fund, launched by United Way and our partners at the Community Foundation, all of which has been distributed to date to support nonprofits and the COVID response. And you sent cards and food and support to our frontline workers throughout our community. You demonstrated what we are capable of, neighbor helping neighbor. And as we have heard through these regular briefings, as hard as this time has been, what is ahead will be even more difficult and will take all of us to achieve. The magnitude of the vaccine distribution is simply unprecedented, reaching 1.2 million residents in the region twice. Add this on top of an already stretched thin, exhausted workforce that must now build a brand new community-wide distribution infrastructure that ensures a quick and equitable process while supply is still not sufficient. It is clear that we can only do this Herculean task by coming together and rallying once again as a community at a tremendous scale in a way we have never done before. That is why today we are calling on those who are able and want to be part of the solution to join in this historic effort to be part of the largest public health response in a generation. In order to support the distribution plans of our county and the Finger Lakes Hub, we need to build a strong and ready vaccine volunteer force that is ready to serve as more vaccine arrives and more sites are established in the coming weeks and months ahead. At United Way, our mission is to mobilize communities for the common good. And if there was ever a time to mobilize, it is now. Let me share some details of how you can join in on this, and the information can be found on our website, uwrochester.org, and brand new at vaxvolunteerunited.org, vaxvolunteerunited.org. On the website, you will see two COVID response options: You can immediately sign up to help support the 4 rapid test sites for asymptomatic people in the city of Rochester. We need to fill 150 non-clinical general volunteer slots each month, and there are openings available now. Thank you to the more than 300 volunteers who have supported this effort to date. And as of today, on the website, you can now apply to join the vaccine volunteer force to support vaccine distribution in the 9-county region. We are asking for anyone who is willing and able to sign up now to begin the review and approval process. It takes only a few minutes to register and answer a brief initial questionnaire. Vaccine distribution has very specific oversight, requirements, and approval processes, including New York State and local departments of health, credential verification, and training. We ask for patience as we work with our government partners and the Finger Lakes Vaccine Hub on streamlining these workflows and abiding by the approval processes for volunteers. Right now, we need people to raise their hand if they are interested and to apply now to join the vaccine volunteer force. We need both clinical and general volunteers. Clinical volunteers will need to provide certification and will be engaged in a series of direct vaccination support roles, including being trained to prepare and administer vaccines. The governor has expanded who can be approved to vaccinate, including EMTs, LPNs, dentists, podiatrists, dental hygienists, and more. See the full list on the website. There is also a tremendous, significant need for general volunteers, non-clinical. Volunteers would do a range of tasks, including registration, data entry, greeters, distributing PPE and hand sanitizer, education, and so much more. Multilingual volunteers and those fluent in American Sign Language are especially needed. As vaccines arrive and new sites open, the need for volunteers will only continue to increase. Imagine in the near future, multiple locations with multiple shifts, days and evenings, 7 days a week across 9 counties. So my message is this: if you want to help, there will be a place and a role for you. Apply today, and over the next few weeks, once approved, you will be able to sign up for the shifts and locations that work for you. Training will be provided by the host locations and following the lead of your local health department. Government and healthcare cannot do this alone. This community crisis requires a community response. This will take all of us. It can sound a bit overwhelming, and whenever I feel a bit overwhelmed and frankly, somewhat in disbelief of the situation we find ourselves living in right now, I often think about my school-aged children, and I envision that time far in the future when their children, my future grandchildren, will one day be reading about this moment in time in their history books. And they may ask, what was it like living through it? What did people do during that time? And I am confident we will be able to address that future question with the answer, we took care of each other. And we will explain how by the tens of thousands, people raised their hands and showed up to help time and time again so we could get through it and begin again. This is our opportunity. For more information and to apply to join the Vaccine Volunteer Force, please visit uwrochester.org. And we will thank you. And let me end by where I started, which is expressing our deep gratitude to you all. Thank you again.
Thank you, Jamie, and thank you and the whole team at the United Way. From the beginning of this pandemic, you never hesitated to step up to the plate every time we asked and see the needs of the community. And we live in a, your inspiring words were spot on. I mean, we live in a community that is caring, compassionate, and there's so many people here who are looking to help. And that's going to be the legacy, I think, of this pandemic years down the road, is how many people were here to help, and linking them to the services that we have to provide to get us out of this pandemic is just incredibly critical. So with that, I want to turn it over now to Dr. Mike Mendoza.
Thank you, County Executive Bello. It's always good to share the stage with you, as well as with Jamie Saunders from the United Way, whose collaboration we could not have lived without throughout this pandemic. Before I share some remarks about vaccines, which is certainly the topic of the day, I do want to step back and remind everybody that we are still in the middle of a pandemic. And while there are signs of improvement, I think there is reason to be cautiously optimistic. We also need to remember that we are not out of the woods by any stretch of the imagination. When we look at hospitalization numbers, they are holding steady, if not improving slightly. When we look at the ICU numbers, they are holding steady, not increasing. When we look at the positivity rates, they are trending down. We are not at the top of the unenviable list of having the highest positivity rate in the state any longer. And so these are reasons to be cautiously optimistic. At the same time, we still need to be mindful that this pandemic has not gotten that much better. When we look at the cases, some days look better and some days don't look as good. Today, for example, we are reporting 575 new cases, which is lower than the rolling average, so there are signs of improvement. But we are also reporting, sadly, 43 newly reported deaths. And so we mourn the loss of 43 additional members of our community. And so while we look at this in the balance of things, there is reason to be optimistic, but I still think we need to continue to remain vigilant, particularly as we look ahead to the weekend. Many of us will be watching football games and wanting to gather with many of our friends and family, and I caution you to use restraint. We know that private in-home gatherings continue to be the most common mode of transmission for COVID-19 in our community. And even though many of us have gotten our vaccine, we are not nearly at the point where we can rely on the vaccine to offer any widespread protection. So the way we protect one another and ourselves and our circle is to wear our masks, to remain distant at 6 feet, and to be very mindful of the gatherings that we are participating in. On the topic of vaccines, I do think that history will look back on today as a very important day. It's the day that we came together between healthcare, government, and the community to step up and undertake what, by every stretch, will be the largest undertaking for public health in our generation. I had the opportunity to visit the Rochester Riverside Convention Center this morning. Things are coming together very nicely at the convention center, and we will be looking forward to opening next week with some doses even being administered tomorrow as we begin the process of making sure all the kinks are worked out in our operations. We're continuing our operations at 111 Westfall here at the Health Department, and we also have the operation at the Fleet Center. All of this is dependent upon vaccine, and we do not yet have confirmation of any shipments that will be coming in for next week, but our job is to be prepared. We would much rather schedule and need to reschedule rather than not be prepared if and when vaccine supplies come. And so our approach has always been to be as efficient and as equitable as possible in the distribution of this vaccine, because at the end of the day, we have a large task ahead of us. And I want to thank again Jamie Saunders and the United Way of Greater Rochester for their help, as well as all of you watching for engaging in this important conversation. And with that, I will turn it back over to the county exec for questions.
Okay, we're going to start with Berkeley Breen from WHEC.
Thank you, Julie. Actually, Adam, I'd like to start with the decision on involving restaurants, and then I'll have a vaccine question after that for Dr. Mendoza. I guess my question is, do you agree with this decision to allow restaurants in Orange to operate at yellow, and what's next? Can we deal with this 10 o'clock curfew?
Yeah, no, thank you for asking the question, Berkeley. I actually want to thank Governor Cuomo for his response to this court ruling today. I think that the state's decision to allow restaurants operating in the orange zone to operate in the yellow zone guidance, go back to that guidance, is the right thing to do. It helps with the issues of equity and fairness, which I raised last week. Have been raising for quite some time between restaurants that are currently in orange, that are right down the street, and those that are in yellow. I think that this is the right move to make, and I am confident in our restaurant owners. I have met with dozens of folks who own restaurants and work in restaurants over just even the last few weeks, and I am confident in their ability to manage the spread, make sure we keep it safe, and make sure that they're operating within the state's guidelines. So I'm encouraged by this news. I'm grateful for the governor for making that decision today. in response to the court decision, and I am confident in our restaurant owners and their ability to manage this.
Thank you, Adam. Dr. Mendoza, on vaccines, my sense is that I think you and folks in the county in doing this have had struggled to get some accurate information from the state or timely data from the state. And I've faced the same dilemma. Yesterday, you mentioned, Dr. Bennett mentioned that 76,000 doses of the vaccine have been delivered from the state to our region. How, as far as you know, how does that compare to what the other regions in New York have received, particularly the Western region and the Central region, which are comparable to our region?
Actually, Berkeley, I don't have any insight into the number of vaccines that the other hubs have received. We've really been focusing locally, doing what we can to make sure that we administer what's coming our way. But I do think that down the road, when the data system is more robust, we'll be able to see into the other regions and into the other counties within those regions, but we're not at that point yet. So our focus right now has largely been local.
Well, let me just add, and then I promise I'll stop. Do you think what our region has received in terms of doses is fair?
You know, depends on how you define fair. I mean, the reality is we all want more. You know, when we look at this on a per capita basis, you know, I don't have those numbers to be able to tell you. We all want more. I think that's the bottom line. I think fairness will show itself in the numbers. And when we are able to show that we've administered this fairly within our community, I think then we can entertain that question. But I don't think I'm in a position right now to be able to comment on whether it's fair compared to other regions.
Thank you, Berkeley. Wendy Wright from Spectrum, you're next.
Hi there, thank you. Just wanted to clarify a little bit more following up on yesterday. Dr. Bennett was saying folks should wait until they hear from either their healthcare providers or from the county in order to get a vaccination. Now that you're opening this location at the convention center, you know, can we get a little more clarification? I was looking at the New York State website and it says you should call your doctor. So there's some conflicting information there. And I still think that there's some confusion out there about some of this. Is there anything else you can say to clarify the information on how and when and where people can get their vaccination?
I couldn't agree with you more. There is confusion, and we are working through the details of scheduling. And I don't want to comment on that until we have them finalized because I don't want to contribute to the confusion. So when we have all those details pulled together, we'll promise you we will get that out. And we want to be very clear about it, but I also want to make sure that we're accurate, because if we can be accurate the first time out, then I think that will go a long way toward addressing the confusion that we all agree we have.
And can I ask you, Dr. Mendoza, again, I know I've brought up this nursing home question with you before. Some of the folks who haven't even wanted to go on camera because they're concerned about backlash from, they say they've been bullied from Bill's Mafia. They're concerned about the fact that the governor and health officials here in our area have paid so much attention to making sure people can go watch a football game, and now that people can go out to eat, which is all, they say, great and wonderful, but they still cannot go visit their own loved ones in a nursing home. And I know your answer in the past has been, you know, the same, that there's a lot of concern about that, but COVID is still getting inside these nursing homes. So what can you tell these relatives, especially some of them who, since we've even spoken about this, have actually lost their loved ones?
Well, you know, I think the football game and nursing homes are, you know, couldn't be more different situations. I think my emphasis in the nursing homes is right now is to get the vaccine out. You know, we largely through the federal partnership directly with the nursing homes themselves, we're looking at very high rates of vaccination among nursing home residents, which is very encouraging. We are still working to improve rates among the nursing home staff. And so my message is, assuming that the residents in our local long-term care facilities will acquire their immunity in the coming month with the completion of their vaccine series, I call upon my colleagues in nursing homes who work in all of the roles in nursing homes to get your vaccine. Do it out of duty to serving those residents in these nursing homes. If we can establish that all of the residents and as many staff as possible are immunized, then I think we can start to consider ways that we can permit that visitation that I think we can all agree is very important. But we also know that the nursing home population represents the highest risk subpopulation within our county. And so we don't want to be taking any unnecessary chances by the same token. So it is a very tough situation. Make no mistake, I completely understand this. I have patients myself who reside in nursing homes. I get it. I talk to their family members. I can completely understand the desire and the need to be with our loved ones. But we don't want to take any unnecessary chances. So I think our effort right now is to promote vaccination as much as we can.
Thank you.
Next question comes from Noelle Evans at WXXI.
Hi, thank you so much. My first question comes from a listener, actually, regarding nursing home cases and deaths, and if those numbers are on the county dashboard, especially with a delay of release till expectedly March 22nd, according to the Empire Center. Someone could please, Dr. Mendoza, if you could please address that.
New York State.
So let me clarify, Noelle, if I could. The New York State Department of Health posts the nursing home data. Is that what you're referring to?
Yes, our listener is wondering if that data is also, if it's coming through the county dashboard at all.
So those data are gathered by the state. As you recall, nursing homes, long-term care facilities are regulated by the State Department of Health. So that's one of those rare areas where we in the local health department don't find out about those statistics on a rolling basis. So no, those all go to the state first.
Okay, thanks for clarifying that. My other question is regarding some of that confusion Wendy had pointed to. I was with somebody who is eligible for a vaccine as they were filling out the form, and when they go to schedule through the Monroe County Westfall site, it took them to the Fleet Center, which only accounts for appointments for healthcare employees. So I know that you're saying that there is some confusion that needs to be worked out. I'm wondering if you could please address this particular aspect.
Well, it's my responsibility. I want to make it right, and I'm working with my team to make sure that we do everything we can to make it less confusing. You know, this is even more important now that we look ahead to opening up the Riverside Convention Center as another site. We want to make sure that we have clear pathways in place to conduct all of the scheduling, not only for the first dose, but for the second dose. So this is something that we'll be working on very, very diligently over the next days.
Okay, thank you.
Mm-hmm.
Thank you, Noelle. Kristen Garzon from WROC, you're up. Yes.
Yep. In terms of the military helping with the vaccine or receiving the vaccine? Oh, we haven't actually been working directly with the military on this. So I think most of that conversation was happening at a national level, but not locally.
Thanks, Christian. Tanner Jubinville from 13 WHAM, you're up.
Hi, good afternoon. I want to ask about the convention center. I was just wondering, can you kind of walk us through a little bit about what this setup will look like, I guess, and go through some of the logistics in terms of number of staff you hope to have, I know you mentioned the number of vaccinations now, but I guess just kind of, if you can, in brief, walk us through there and just talk about some of the details and logistics of it.
Sure, I'll take that one. So the way it's set up now is that people would enter on the street level. There is an area in the beginning where we would pre-screen individuals, checking their temperature for symptoms, making sure that they're safe. This would be for people receiving the vaccine. We have an analogous process for those who are working the site very similarly. You'll enter in, there's paperwork that will be done. a variety of screening happening. In terms of staff, we're starting slow. We have both non-clinical and clinical staff that are getting onboarded as we speak. Looking at a ratio of about 10 to 1 in terms of non-clinical to clinical staff. And then, they'll find their way maintaining social distance, which is why the convention center is so great. You can keep, good distance between everybody who's there. We have a pharmacy set up where the vaccine prep will happen, and the room adjacent to that is where the administrations will happen. Again, socially distanced, there's curtains and barriers and all of that to maintain privacy. And then we have the observation center, an area where people will wait for that 15 minutes. We'll have medical personnel on site, any emergency equipment that we might need in order to take care of people who might have a reaction. And then they'll exit in a way that doesn't have them double back on the path coming in. So it's actually very, very organized. This is the path, this is the plan that we've developed, long before this. It's actually very exciting to see it come to fruition. So I'm very excited to get this project going.
And I have a follow-up on the vaccination topic. Is there any concern that the rapidly expanding eligibility could slow access for those who are maybe over 80, over 90, maybe those who were in the first phase, but now it keeps expanding? So is there any concern of that locally?
Well, when you're looking at a situation where demand outpaces supply by a good margin, there is some element of honor system here. And, we can't completely police every step of the way. What I can say is that 1A is a higher priority than 1B. And I would encourage people who are, considering when to get their shot, if you know somebody who's a 1A, in the 1A category, encourage them to go with you. Try to get them to get their shot. But at the end of the day, we want to get vaccines into arms as quickly as possible. So, it does feel like that right now because supply is still quite limited. But I do think that once that opens up, a lot of those concerns will be improved.
Thank you.
Mm-hmm.
Thanks, Tanner. Tyranda James from Minority Reporter. Tyranda? Okay, well, she might have a new issue. We're going to move to Brian Sharp from the Democratic Chronicle.
Thank you. I was wondering, this is to Dr. Mendoza, if you could comment at all on, we are seeing these, particularly with the number of deaths, where those are occurring, and do we know anything about the demographics of those who are passing?
I haven't run the data in a couple of days, so perhaps we could pull something together and get that up later on. The age and the race ethnicity data, we can pull that together.
And then I was wondering on the convention center, I know we've gone back and forth or gone over the scheduling issues, but do you have a time on when you expect to begin scheduling? And my understanding from the call yesterday was that the county was kind of taking the categories of basically employment, and the hospitals were maybe taking age. Is this going to be an open to all comers, or are you going to continue on that model?
We're going to try to continue along that model, recognizing that once you have a scheduling system that's public, we're not going to stop somebody who is, 65 who wants to register on the basis of age. There's no way, nor is there a desire to stop that. But we're going to want to focus on those occupation-based populations, and the healthcare systems will focus on the age and medical condition indications.
And when were you going to start scheduling for the convention center?
We're looking at this weekend. At some point this weekend, once we work out the delays, we're going to want to do a slow opening to make sure that we work out the kinks and try to do what we can to prevent the confusion that we all want to avoid. But we're looking at starting that over the weekend.
Thanks, Brian. Our final question is from Gino Finelli at City Newspaper. Gino, are you on?
Okay, was that the last question?
I believe so. I think we're done.
I don't see Gino.
So I just have some final thoughts, and then if any of the other folks as well. A couple things. a recurring theme that I know is that involved in a lot of the questions that have been asked today is around confusion as to when you're eligible, when there'll be vaccine, and your ability to make an appointment. And really this, that I think is being driven by a couple things. One is an intense demand for the vaccine, which I think is a good thing. I also have that same demand for myself. When I'm eligible to receive one, I can't wait to receive the vaccine, for my family members to do the same. So it's a good thing that we have a demand. But what we also have is a situation where demand and eligibility under the phases far outpaces where we are in terms of supply. And so the challenge is, even as you're scheduling out into the future, is that we even know what slots we have into the future in terms of the county pod sites, and the hospital systems are obviously managing theirs. The federally qualified health centers are managing theirs. Everyone's managing their distributions, and the pharmacies. But we don't know far out into the future how much vaccine there will be, what that supply is to meet the demand. We know the demand. We know who's eligible. We know who's eligible based on their employment status or their age, and we know, and we know what that demand looks like. But what we don't know is the supply. We know the supply week to week, and that's not something that we can control. So what we're going to try to do, and we'll continue to do, is work with all the different groups, whether it's the health systems, and so their patients who are 65 and older, whether it's the employers and the trade associations that they belong to make sure we can get their employees into the queue. We're going to continue to work with them week over week over week as the supply increases, hopefully increases, and we continue to increase our capacity to administer that vaccine so that the capacity always outweighs the supply. I always want to be in a position where our ability to administer the vaccine is greater than the supply. That's the ultimate goal, so that as the weeks start to go out and we find ourselves in February and March and April, and the eligibility list continues to grow, hopefully the supply continues to grow as additional vaccines are approved for distribution, as the manufacturers step up their manufacturing process, we're ready for that influx. So we're going to continue to do that, but confusion is going to be natural, is natural, and I think a frustration is natural throughout this process as well. So we're really asking the community to be patient with us, understand we're working as hard as we can to get those vaccines in arms, but we only have so many vaccines. So we know who you are, we know what organizations are eligible, we know what professions are eligible, and we know the age groups that are eligible, and the healthcare providers know we're all working together, but we really just have a situation where demand and eligibility outstrips supply. I also want to just comment, going back even to the restaurants now being able to operate in the yellow zone. And I know there's a lot of talk about the Buffalo Bills game this weekend. I want to remind the community, while we're cautiously optimistic about our numbers, they're certainly not today, over the last several days, the 700, 800 new cases a day. We're still in the middle of a pandemic. The numbers are still far too high. And we just need to remember what works. Wearing a mask, social distancing are two things we have to continuously remember to do and double down on. Now is not the time to loosen up just because the numbers seem to be getting a little bit better, because the vaccine is now here and being administered. Now is not the time to loosen up. Now is time to double down. Do what we know works so we can make sure those numbers still continue to go in that right direction. We need the numbers to go lower than they are today, and I have all the confidence they will. The more vaccine that we put into arms every day and every week is more people who are protected from COVID-19. And so the numbers hopefully continue to go in this direction, but they're only going to go if we do the right thing, which then means I need to thank the community for doing the right thing, because we have been able to feel that cautious optimism about where we are. But it's cautious because we're doing the right thing. The numbers are where they are. We just have to prevent that spike and give our healthcare systems the space and the personnel that they need to administer the vaccine. The hospitals are still overwhelmed with patients. There's still far too many patients who are in the ICU and in hospitals struggling with COVID-19. So we need to keep doing what we're doing. And then the final thought that I didn't raise earlier was just on rapid testing. Just a reminder, the rapid testing is still part of this community and county's response to COVID-19. Next week's rapid test sites appointments will go live tomorrow at noon. We'll have all the appointments for next week live. They're free. It's available to the whole community, no matter where you live. So please sign up for an appointment next week. It's critically important, like we said, that we have that community surveillance, we have the testing out there, but also that we find positive cases quickly so we can get people isolated and quarantined as quickly as possible. That's how we can help also manage the spread. So tomorrow at noon, next week's appointments will become available. If anybody has anything else to say, with that, thank you.